Hello everybody, how are you? My name is Rosie and welcome to my channel. Here we give tips on how to have good mental health every day and improve your quality of life. In this video you will find out what are the 8 most common types of depression that exist and what the symptoms are. I know what you're feeling. I've suffered from depression. I know what it's like to lay your head on your pillow every night and feel that emptiness in your mind, in your soul, with the feeling that no one cares about you or what you do. You're feeling it. I know it's not easy. The desire to end your own life passes all the time in your head. Nothing else makes sense. The feeling is that we're falling into an endless abyss. But there is light at the end of the tunnel. There are 4 tips that you can apply in your day-to-day to relieve symptoms quickly. I started to apply it in my routine, and it made all the difference. It improved my self-esteem and productivity a lot. I started doing some hours what I did in several days. If you also want to learn how I managed to do this, I suggest you watch this video until the end. First, I kindly ask you to like the video, subscribe to our channel, and share it so that the greatest number of people suffering from this disease can be reached with this video. If you, like me, are tired of looking for a solution to beat this disease, you have already spent a lot of money on medicines and therapies that have come to nothing, rest assured that here in this video I will give you a step-by-step guide to what you should do to get rid of this disease permanently. Guys, depression is serious. As much as depression has characteristic symptoms, such as sadness and low spirits, it can manifest itself in different ways. Each type of depression differs in duration and even symptoms. Depression is a very common health problem, according to a global report released by the World Health Organization, who, in 10 years, cases have increased by more than 18%, in a rate that exceeds 320 most. A depressive episode can be categorized as mild, moderate, or severe, depending on the intensity of symptoms. Some of the signs of the disease are anxiety, changes in appetite, weight and sleep, chronic pain, agitation or motor slowness, fatigue or loss of energy, feelings of worthlessness or guilt, difficulty concentrating and making decisions, and in more severe cases, thoughts of death and suicidal ideation. In addition to these described items, which must be present for at least 2 weeks, the physician also needs to consider the patient's life history when making the diagnosis. However, although it seems like a single picture when we look at depression in this way, there are different types that have different symptoms and impacts on everyday life. See below the most common depressive pictures and their characteristics. First, major depressive disorder, unipolar depression. This is the most common and known type of depression. It is characterized by depressed mood, loss of interest and pleasure, reduced energy, decreased activities, and, in more serious cases, suffering, melancholy and temporary disability, especially when left untreated. Second, bipolar depression. Bipolar disorder is different from depression, but this type is on this list because the person experiences episodes of extremely depressed mood that meet criteria for major depression. It is the alternation of depressive moments with periods of extreme, euphoric or irritable, called mania, or a less severe form, called hypomania. Third, dysthymia, persistent depressive disorder. This is a form of chronic depression, lasting at least 2 years, of moderate intensity, when the individual is predominantly sad, discouraged, pessimistic, and unwilling to act, with little energy and concentration. A person diagnosed may have episodes of mania, along with periods of less severe symptoms. Fourth, baby blues. Symptoms can appear in the first few weeks after childbirth, or even during pregnancy. Feelings of extreme sadness, anxiety, and exhaustion can make it difficult for the mother to carry out daily activities to care for the baby and herself. It's far more serious than the feeling of anxiety many women experience after giving birth, which usually goes away within 2 weeks. Fifth, premenstrual dysphoric disorder. Known as PMDD, it appears almost every month in the period before menstruation and should stop when the cycle starts. Like PMS, it stems from a drop in estrogen, the female hormone. The symptoms, however, are much more severe than common premenstrual tension, to the point of leaving the patient unable to perform activities due to sadness, irritability, a desire for isolation, and a lot of indisposition. 6. Seasonal affective disorder. It is the name given to depression during the winter months, when there is less natural sunlight, particularly in temperate countries, where winter days are short and exposure to light is reduced. Winter depression, which tends to recur every year, is accompanied by social withdrawal, increased sleep, and weight gain. 7th. Psychotic depression. It occurs when a person has severe depression and psychotic symptoms, such as having false beliefs, delusions, and hearing or seeing disturbing things that others cannot also notice, hallucinations. Psychotic symptoms usually have a depressive theme such as delusions of guilt, poverty, or illness, and may also have a persecutory content. 8th. Substance/drug-induced depressive disorder. It is associated with ingestion, injection, or inhalation of a substance, drug of abuse, exposure to a toxin of medication, and includes symptoms of a depressive disorder that persist beyond the expected duration of the physiological effects of the intoxication or period of withdrawal. It's personal. Depression is already considered, according to some studies, the disease of the 21st century. It is estimated that by 2023 it will be the second leading cause of death among humanity, and currently, with all the situation we are experiencing, a pandemic, social isolation, the trend is increasing more and more. That's why it's important to prevent yourself as much as possible. The 4 tips that helped me a lot and will help you are: First tip. Get some exercise. When you move, your body naturally releases hormones that help improve your mood a lot, gaining more resistance when facing difficult situations. Take a walk, run on the beach, ride a bike, get moving. Any exercise is better than none. This simple habit will make you gradually rebuild your routine and make it more agitated. Second tip. Improve your nutrition. This is a super simple step that you can change little by little in your day-to-day. Avoid eating industrialized foods, prefer more natural foods, fruits, vegetables and legumes, which, in addition to being good for our health, improve and our mood a lot. Third tip. Talk to your friends or family. It's very important to connect again with people, with your friends, your family, even if you're not meeting in person. Chat on WhatsApp, on the phone. It's so nice to catch up. However, when we are sad, it is normal for us to think, but I have nothing good to talk about. What will people want to talk to me about? That's where you're wrong. This is an excellent opportunity for you to exercise empathy, to put the other person at the forefront of the conversation. Ask how the person is, what they have been doing in life, if they are happy, if they ask how you are. You don't have to lie, but the exercise here is always to keep your focus on good things. You have no idea of the change that this simple exercise causes in our brain. Fourth and last tip. Seek treatment for depression. Seeking specialized help is the best way to get rid of this disease. A mental health professional will accompany you and give you techniques on how to deal with difficult situations and return to a full life. It is worth remembering that depression is a lethal disease and that many people end up taking their own lives because of it. So don't play with it, look for specialized treatment. In the description of the video I will leave the link to the treatment I did. It helped not only me but thousands of people who suffered from this disease to get back on their feet. Guys, summarizing the 4 tips. Get some exercise. Improve your nutrition. Chat with friends and family. Seek treatment as soon as possible. This is the path I took to be able to beat this disease. How are you currently feeling? Leave your comment and I'll be very happy to read and answer you. I'm sure you'll beat depression just like I did. A big hug and stay with